You're sick.
What are you talking about? Sick. Like, really? I'm well, I'm okay, I'm fine.
That's exactly what we hope that will happen for you. That your future will be fine. That your health and your well-being will be absolutely fantastic. And if we can learn from it, and we can, the Corona-19 virus, the whole COVID-19, the whole pandemic. Let's check out what 2 articles have shown us and proof now that it came about much earlier than what we believed and felt and knew in early 2020. So the pandemic was here before 2020. It was here in Europe, in America more than likely, before even the end of 2019. How early before? What that has in store for your health, let's see. This first article is about the novel coronavirus, which circulated undetected months before first COVID-19 cases were in Wuhan, China. Now this is incredible when you think about it. The University of California in San Diego noted that, believe it or not, they reckoned using molecular dating tools and epidemiological simulations, researchers of this particular university said that they reckon it's more than likely that it was before, and even 2 months before 2019 ended. So that means October-ish, maybe late September, that the virus was there. Now, that means that in your country, be it in Europe, America and so on, whatever you were doing there and then, however you were feeling there and then, dictates exactly how your body was, your makeup was, your immune system, and then however you reacted to things when you realised, when the whole mass media went and said, oh, warning, stay in lockdown, there is a pandemic, a world pandemic, first time in your lifetime, a world pandemic. And when that came about, you didn't know how you would react. I mean, if you were told 5 years before, hey, there's a pandemic on the way, how would you react? A lot of people say, oh, I'll react in a certain way. But you now know how you react to times of mental pressure, because we've all gone through this. So, the fact that it was actually here, the virus more than likely, in your land, before all of that, not just your body, brain and mind though, are also part of how you will feel in the future and how you can dictate how you will feel in the future, because our thoughts create what we become. So with that in mind, you've gone through this panic, you've gone through all of this, you're still alive, thankfully, and all the poor people that have passed because of this. The reality is, you can use this information with regard to how you feel in the future and how you will actually prepare for things in the future, which is really cool. Quote unquote, this particular article was, to answer this question of when COVID hit, the researchers, quote unquote, we combined these important pieces of information, a detailed understanding of how SARS-CoV-2 spread in Wuhan before the lockdown, the genetic diversity of the virus in China, and reports of the earliest cases of COVID-19 in China. By combining these disparate lines of evidence, they said, we were able to put an upper limit, I say, of mid-October 2019 for when SARS-CoV-2 started circulating in the Hubei province. That's kind of scary, isn't it, when you think about it? Now, but you have to think to yourself, where was I? What was I doing in October, November, December 2019? Because these are the months that are really important. I can remember where I was, what I was doing. It was my birthday around that time. And I can remember how I socialised, who I was with, where I was. Was it close proximity? Was it wide? Was it outside? Was it indoors? So this study is done by the acclaimed Harvard University in the United States of America. Now, what they found was that their research on this was based on satellite imagery initially. Now that's pretty cool when you think about it. Satellite imagery of traffic movements around hospitals in Wuhan and the tracking of online searches for specific medical symptoms. Now that's intriguing. Watch the picture. They have all the traffic and the changes and the flows of traffic, so they can compartmentalize what happened in the months of October, November, December, and even before that, September and August. And they found that as of late August to December 1, there was traffic changes and there was more approaches towards hospitals. Why? Because there had to be something wrong. I, me, and you were feeling not as good as before. So then they went on to the internet and they started checking out, well, what if these guys are traveling in the cars? What are they searching to make them travel? What is on their minds? What's up in their brains at the time? And what they found out was people were searching for terms like cough, diarrhea. They were searching for what are the symptoms I have, not feeling well, sickness and so on. Now, why would people do that if they weren't kind of feeling it, or they knew of somebody else that were feeling it? Unless, okay, fair enough, maybe they all wanted to be medics, nurses, doctors and so on, and they were visiting the hospital to do a research project, and they decided to Google or search online for cough and diarrhea. Maybe that's it. But that's a little bit more specific. Like, come on, how many people do that? The reality is there was a lot of people doing this. It's a big place, China, and Wuhan ain't that small. So that means back to August. Imagine, August 2019. What were you doing? You may have been asked this in your life by a private investigator, by somebody. What have you been doing? Where have you been? Where were you on the night of such and such when somebody went missing or got murdered? I hope that hasn't happened to you. The reality is you have a larger time span now. You have August, September, October, November and December. Pretty much a third or more of the whole year of 2019. I'm sure you can check your emails. You can check your phone. You can check your texts. You can check received texts. You can check your diary. And you'll figure out exactly where you were at some stage. Were you in a crowded room at any stage? Was the weather really bad? Cold? Misty? Wet? Did you have a wet coat on indoors after all of that? In an enclosed space? Were you really close to somebody for a long time? Close proximity? Were you actually speaking to somebody in a tight area? Were you in a bar? Were you in a nightclub? Were you in a restaurant? Were you in a cafe? Ask yourself all these questions. I'm sure if you ring up your friends and you ask them, hey, remember when we were in such and such a place, or were we in such and such a place, you'll be able to decipher exactly, maybe not date, but definitely what month. Which means in the future, you'll be able to dictate physically how strong you're capable of whole COVID-19. If you're in isolation or in quarantine and you haven't had the disease, the virus, thankfully you have not had it. That's fantastic. But remember, you can actually look back and say, well, how's my system right now? How was it right then? More than likely it was swimming around somewhere, and you, if you were, that is, in a place indoors, in a tight space with bad ventilation, it could very well have visited your lungs and into your system. But also the mentality of the shock factor. What happened when the pressure was on, and what happened in early 2020 when pandemic was all over the screens, was on the internet, and was in the news. How did you up there think? Only you will know, because that is how you will be able to project and help yourself through your thoughts to your body, and what you put into your body, and how you socialize with people, relate to people, what you think about doing in life. All of that comes from up there between the ears for you in the future. So if you've overcome the COVID-19 and you didn't actually get it, and you didn't actually think or panic in a pressurable way, being pressurized by all this media around you, all the people panicking, you're a special person. Give yourself some kudos. In the future, you will be healthier than you think. Until next time though, hit that button and have a wonderful day.